Have you ever found yourself wondering, do I have a fever? Maybe you've felt warmer than usual or noticed your child looking flushed, and suddenly, there's that nagging question, is this normal, or should I be worried? Understanding what actually counts as a fever can be tricky, especially when body temperature isn't just a number, but something that shifts depending on your age, how you take it, or even what time of day it is. And here's the thing, fever isn't always something to panic about, but it could also be a sign that your body's fighting off something more serious. What is a fever? So, what exactly is a fever? Most people would say it's any temperature over 100 degrees Fahrenheit, 37.7 degrees Celsius, and that's pretty close to the mark. A fever is your body's natural way of responding to an infection or illness, like when your immune system is trying to fight off a virus. It's important to know, though, that a fever is not the same for everyone. The definition of a fever changes depending on your age and even how you take the temperature. For example, the typical body temperature is around 98.6 degrees Fahrenheit, 37 degrees Celsius, but that can fluctuate. It's not set in stone. Your temperature may run a little lower in the morning and higher by the afternoon. Plus, your normal might not be exactly the same as someone else's. What's key is to understand your own baseline and pay attention to changes from that. Fever by age group. Let's break it down by age groups because this is where things get a little more specific. Babies, children, and older adults each have slightly different thresholds for what constitutes a fever. This makes sense when you think about how their bodies work differently. Babies, 0 to 2 years for babies, especially under 3 months, a fever is a big deal. A rectal temperature between 97.9–100.3 degree F, 36.6–37.9 degree C, is considered normal. But anything over 100.4 degrees Fahrenheit, 38 degrees Celsius, rectally, you're looking at a fever, and that's when you should call your doctor right away. Children, 3–10 years for kids in this range, oral temperatures from 95.9–99.5 degree F, 35.5–37.5 degree C, are considered normal. A fever would be anything above 100 degrees Fahrenheit, 37.7 degrees Celsius, taken orally. Adults, 11–65 years as an adult, your normal range is between 97.6–99.6 degree F, 36.4–37.5 degree C. Again, anything over 100 degrees Fahrenheit usually means you're running a fever. Seniors, 65 plus years as people age, their normal body temperature can run lower, around 96.4–98.5 degree F, 35.7–36.9 degree C. So, even a slight rise above that could signal a fever for older adults. Methods of taking a temperature. Now, let's talk about how you take a temperature because not all methods are created equal. There are 4 main ways to check: rectally, orally, in the ear, and under the arm. Here's the catch, each method gives you slightly different results. Rectal temperatures, this is considered the gold standard, especially for babies and young children. Rectal readings are the most accurate because they measure core body temperature. If you're really trying to get the most precise reading, this is the way to go. Oral temperatures, a lot of us use oral thermometers, but keep in mind that oral temperatures tend to be lower than rectal ones. So, if you're measuring orally, anything above 100.4 degrees Fahrenheit, 38 degrees Celsius, could count as a fever. Ear thermometers are super convenient, but they have to be used correctly to get accurate results. Make sure you place the tip into the ear as instructed, wait for the beep, and then check the reading. Underarm temperatures, while it's less invasive, taking a temperature under the arm is also the least accurate. It can give you a general idea, but it's not the best if you need to be certain. Low-grade versus high-grade fevers. So, we know what a fever is, but not all fevers are created equal. Medical professionals generally categorize them as either low-grade or high-grade. A low-grade fever is typically anything under 102.2 degrees Fahrenheit, 39 degrees Celsius, rectally. This could be your body's way of handling something small, like a common cold. It's uncomfortable, but not necessarily a cause for alarm. A high-grade fever, however, is more serious. When the temperature spikes above 103 degrees Fahrenheit, 39.4 degrees Celsius, that's when things can get more dangerous, especially for babies or older adults. This is often the point where you should seek medical attention, especially if it's paired with other symptoms. Causes of fever. Now, why do we even get fevers in the first place? Fever is usually your body's way of saying, something's not right. There are many possible causes, some of which are more concerning than others. Let's take a look at a few of the most common ones. Infections. One of the top reasons for a fever is infection, whether it's bacterial or viral. Think about illnesses like the seasonal flu, strep throat, urinary tract infections, or gastroenteritis. These all come with a fever because your body is raising its temperature to try and kill off the invading germs. COVID-19. Fevers have been one of the hallmark symptoms of COVID-19. Along with fever, many people experience coughing, fatigue, shortness of breath, and loss of taste or smell. Cancer. Fevers can sometimes be an indicator of blood cancers, like lymphoma. In these cases, cancer cells might produce signals that raise the body's temperature, causing a fever. Heatstroke. If you've spent too much time in the sun or a hot environment, heat-related illnesses like heatstroke can cause a spike in body temperature. Trauma and pain. Believe it or not, your body can also develop a fever after an injury. White blood cells release chemicals like prostaglandins and cytokines, which can raise your body temperature when you've been hurt. Drug use. Fevers can also happen due to drug use or withdrawal. For example, withdrawal from alcohol or amphetamines can lead to a fever. Certain prescription medications, especially those for treating seizures, might list fever as a side effect. When to seek medical attention. So, when do you need to take a fever seriously and get medical help? Here's the good news. For most people, a mild fever is nothing to stress over. If it's low-grade and short-lived, your body is probably just doing its job to fight off an infection. But, there are a few times when a fever should definitely grab your attention. Babies younger than 3 months. If a baby this young has a fever, it's a medical emergency. High fever, over 103 degrees Fahrenheit or 39.4 degrees Celsius. A high fever in anyone, but especially young children or older adults, should prompt a call to the doctor. Fever lasting more than 2 days. If a fever lingers for more than a couple of days, it could be a sign of something more serious. Fever with additional symptoms. If there are other concerning symptoms like confusion, trouble breathing, severe headaches, or signs of dehydration, it's time to see a doctor. Conclusion. Fevers are a normal part of life. They are often a sign that our bodies are working hard to fight off something harmful. But not all fevers are created equal. Understanding what constitutes a fever and knowing when it's time to seek medical attention can go a long way in helping you or your loved ones stay safe. And remember, while a mild fever isn't usually something to worry about, it's always good to trust your instincts and check in with the healthcare provider if something feels off.